So welcome today to today's seminar series. We've got two speakers today. We've got Alina talking about her PhD project, which is entitled Not Every Picture Tells a Story, and Yanushka talking about her master's research with Otis. So without further ado, we'll get started because I think we have a bit to get through, and I'm going to pass over to Alina to do her presentation.
Hi, so I'm Alina, and today I'm going to talk to you about the use of images for patient education. And not only because it's the topic of my PhD and you don't get to talk about your PhD that often, but also because I think it's a good and interesting area to talk about. And if you can turn on your cameras, that would be lovely, so I don't feel like I'm talking to myself. No pressure though. Okay, so probably many people have heard this expression, a picture is worth 1,000 words. And in many ways, that's kind of true, and there's a good reason why it might be the case. So there are a few theories which explain why pictures are good. And probably the most commonly used theories are the dual coding theory and the cognitive theory of multimedia learning. I'm not going to go too much into detail here because we don't have that much time, but the idea here, both theories talk about how images are processed in a different channel to verbal information. And for example, the dual coding theory says that images allow you to encode more information at the same time and recall more information at the same time. So for example, if I asked you to describe your room with your eyes closed, probably you would be able to name some objects in the room. Whereas if I gave you a list of the same objects and asked you to memorize it, probably it would be more complicated. Also, people are still coming. Also, empirical research also suggests that images, illustrated materials generally yield better results than unillustrated in terms of understanding and recall of medical information and compliance with medical instructions. But things like wound care instructions, discharge instructions, medication instructions, skin self-examination for melanoma skin cancer. So usually people comply a bit better when they see those instructions with illustrations than without them, and understand how to perform the procedures too. Okay, doesn't work. Anyway, so pictures are good. I get it. So we have this picture here. What do you think it's telling us? Me, well, you can't answer, but to me it looks like this lady has some chest pain or maybe some respiratory symptoms.
Is she looking at something?
Yeah. But I mean, of course, it's hard to understand the image without the context, and here's the context. So this is a page from Arthritis Foundation, and the page is about causes of gout. And I don't know how much you know about gout, but gout is a form of arthritis, which is more common in men, and there are no respiratory symptoms associated with gout or chest pain. What about this one? This image is supposed to tell us all about gout. Again, and there are so many images out there. If you have an Instagram account, you probably know. So it's really hard to tell what to use. So we decided to do a study and to have a look at the images that are currently used in patient education materials about gout. Sounded like a great idea at the time, so we decided to look for everything we can find from credible sources and to evaluate the content of those images. To see the type, are they photographs, are they simple drawings, are they medical images, things like that, and also the content, what information they convey about the illness and treatment. Why gout? Good question. Well, Gout is a chronic condition, and it's a chronic form of arthritis, and it is manageable with long-term urate lowering medication. But as we know, with chronic conditions, sometimes adherence can be challenging, and people need this medication every day, long-term. And long-term is a safe way of saying lifelong for most people. And adherence, unsurprisingly, is suboptimal. The study by De Vera found that it was about between 10 and 46%. Another study compared adherence rates among people with 7 chronic conditions, and they found that people with gout had the lowest rates compared to the other 6, and this difference was significant. Okay, so what is gout? Just briefly, gout is caused by high levels of serum urate, and when there's too much urate, it forms crystals in the joints. And it's mostly genetic. It's not related to lifestyle or diet, as many people believe. But again, there are common beliefs and not too much education about this topic. So here's how it looks like. We're talking about pictures. Here's a picture. And this is a CT scan showing deposition of urate crystals. They're shown in green. And here you can see they're sitting in the area of the big toes and the ankles. And big toes are usually the area where people get their symptoms first. Not always, but it's quite common. So it starts as attacks of sharp, very severe pain in big toe or just in the foot. Usually people describe it as 7 out of 10 on the pain scale. And those attacks will last from 7 to 10 days, and they will self-resolve. And again, then it will be followed by a relatively symptomatic period. But people need to take medication regardless of their symptoms. If they have symptoms, if they don't have symptoms, they need to take urate lowering medication to make sure serum urate is suppressed. So what we need to know about gout, and patients with gout need to know. It's a lot, but key points are, so first of all, gout is caused by high levels of serum urate. And when there is too much serum urate, it forms crystals in the joints. And those crystals cause symptoms. Second point, people need to take urate lowering medication to suppress serum urate. And they need to take it for a long time to make sure that serum urate stays low, because if it does, crystals over time can disappear. It means less attacks or less severe attacks. So essentially it means that gout will be under control. And people need to take it every day, regardless if they have symptoms or if they don't have symptoms, because if they stop taking this medication, serum urate becomes high again, meaning crystals are growing, and it just keeps going. And also, it's important to know that diet and healthy lifestyle can help get rid of 20% of urate compared to 80% by medication. So what we did, we just decided to find all the resources we could, which were available online for patients in English in 7 English-speaking countries, and to just do a content analysis of all images there. I'm not going to go too much into detail about inclusion and exclusion criteria, because you can read the paper if you are interested, and it really takes a lot of time just to describe that. But just briefly, we looked at resources dedicated for patients and their families, for the general public, so meaning no materials for health professionals, only materials in English, and only in 7 English-speaking countries. We did not include materials from newspapers, social media, general knowledge websites, for example, Wikipedia, mainly because it is really a lot, and we wanted to look at the resources which health professionals might recommend and which patients may find from sort of credible resources. Okay, so how did we identify the materials? Well, Google knows everything. So we used the search term gout and searched in each geographical region using Google Advanced Search tool. And I'm not going to describe it a bit further, okay? If you have questions, just ask me at the end. And that's how a lot of materials looked like. So a lot of them had no pictures whatsoever. So we know that pictures are good, but we just don't use them. So we identified 103 unique educational resources, and out of those, about 30% had no images at all. 4% had only videos and no pictures, so we had to exclude those. And we ended up with 71 free source, 310 images, 53 web pages, and 18 PDF files. So we had 2 independent raters who scored the images. So what did we find? And we found that the majority of pictures, 60% were photographs, which looked like these. And here's an interesting one, because knee pain is not the most common symptom of gout, although there might be some pain in the knee, but it mostly in the hands or in the toes or just in the feet, in the ankles. But a lot of pictures for some reason showed knee pain. Right? Then there were simple line drawings, things like that. You know, just basic shapes, which are technically considered as pictures, but cartoons. So this cartoon had a caption, a man with gout is being helped onto a horse. Anatomical drawings looked something like this. So just basic shape of the foot with some joints. Medical scans. Quality varied. Oops. And graphs and other were just microscopy images showing urate crystals or a combination of those. What about the content? That was interesting. So 30%, about a third, showed symptoms of gout, which is not surprising. About a third, 29%, showed nothing. Well, essentially, they did not convey any information about gout or treatment. I'll show you some examples later. Also, if you remember how we talked about 20% being diet and healthy lifestyle and 80% being medication. So medicines were shown in 5% of images, and food and healthy lifestyle related content was present in 24% of images. 16 conveyed some information about urate crystals or urate. So symptoms looked like this. So we had a lot of people in pain with some redness and swelling. Then people with tophi. So tophi can grow on hands, elbows, and knees, and even ears. There were some scary pictures showing ulcerations that could happen when tophi get infected and people can get skin ulcers. Food and healthy lifestyle. There were people exercising, obviously drinking water. There were some people surfing for some reason. And this image is actually from Arthritis Care and Research booklet, but I don't know what they're trying to say here, but you know, the person is having a nice time, which is good. Food. Food is another interesting one. So this is from a real website. They talk about prevention techniques, how to prevent gout attacks, and then they have this picture. So probably eating junk food is not a good prevention technique, but you know, that's another story, how you embed images in educational materials and how they work with what's present on the site. And this one. So this one is from the same website. They, for some reason, like weird titles. It says avoid purines, and then they have this image. And this image is actually showing what this website recommends people with gout to eat. So it doesn't really go well together. Medicines, only 5%. And most of the pictures looked like this. So they just showed some pills. And if you think about this, why? Because people take actual medication. They have actual names. They have actual boxes. And how many pictures do you think show the real medication? No, that's a good answer, 1. And this is the medication that people use only for acute attacks, so they don't use it long term. This is not the medication people should be taking to lower their serum urate. So this is an anti-inflammatory medication and a pain management medication. There was one picture that had a name, but it showed just a generic pill, and it had a title, allopurinol, which is the medication people need to take. As I said earlier, about a third were non-gout specific, and they looked like this. There were happy people. There were sad people too, a lot of sad people, and a lot of happy people. I don't know what was going on there. Some people were just having a good time surfing or just camping somewhere. Some pictures of doctors, some pictures of doctors with patients, or just you could see sometimes a part of the picture, just a doctor's hands and someone in a lab coat. So overall, we found that actually important concepts about gout were not communicated that well. And this is, I don't know, to me it's a bit of a shame, because it's not hard to take this third of images that do not convey any information about gout and make them specific. It's not hard to tailor those images to be more effective, I don't know, to convey important things. So content of images is important. Again, common sense, still not in place for some reason. Also relevance of the content as well. So we found that, for example, when there were doctors with patients, the majority of patients represented were male, and about, so 63% were male and 19% were female. The rest, we couldn't tell from the image, because it was like a part of the person. But sometimes, and qualitative studies do show that women who do get gout, they feel like they're not represented, that the materials are not that relevant for them. So they would probably want something more tailored. Also ethnic groups. So this image is from the Ministry of Health booklet about gout, which is the main resource here in New Zealand. And when I was doing my first study, people were like looking at this image because I used it and like, oh, this guy looks too white, or this guy looks too brown. And here they're trying to say that gout is common, more common in Maori and Pacific people, and it is, but and the reason why medical images are good is because bones, and I show you a CT scan, and bones are essentially the same. So you don't have this problem if you're using medical images. Also, the severity of the disease. Again, if we're showing people massive tophi, if we're showing amputations, if we're showing ulcerations, is it too scary? Is it relevant if the person only has minor form of gout? Maybe scary is good. Nathan probably would think it is good. But again, we don't really know here. Also, how images interact with the text, and in research on learning and instruction, there's a lot about how to place an image, how we're placing it, if we're placing it before the text, next to the text, after the text, are we doing spoken text or are we doing written information? And they're really obsessing about it, but in patient education, it's really rare to see research like this. So again, we need to think about how images interact with the text. Again, common sense, but I don't know why I need to talk about this. People don't do it still. Image style. So are we going for simple images? Are we going for medical scans? Because it is different. And the most patient education guidelines say use the simplest mediums possible. But again, there are studies that show that people prefer more complicated images, and we did one. We showed people one of the 4 leaflets about gout. So one had no images, one had a simple shape of the foot and a medical scan and an anatomical drawing. And people who saw this image, they said it was helpful. People who saw this image said it wasn't helpful. But then people who saw this image answered comprehension questions correctly compared to those people. But again, here is a question of what are you doing? Why are you doing this? What is your population? Again, common sense, but sometimes simpler visuals work better. Sometimes more complicated images are better because people just are not used to seeing them, and it maybe grabs their attention. Okay, so then how do we present those materials? Is it a leaflet? Is it a booklet? Is it just printed information or online information that people can search for? Or if we're using some kind of visual aids during a face-to-face consultation, because there are differences. For example, with this one, we used the same image in a couple of studies, and we found that in a leaflet, people didn't like it and it didn't really work. So this leaflet with a CT scan actually was the same, very similar in terms of results as the text-only one. And there was no explanation of the image. It was very short and simplistic. But when we used medical images in face-to-face intervention, then they were beneficial. They were actually similar or more interesting to view than just standard images from a booklet. So they are different. Again, this is not an exhaustive list. It's just a couple of ideas, and I think I'm running out of time. So I just want to thank my collaborators, obviously my supervisors, Keith Petrie and Nicola Dalbeth, and Christina Dirksen, who was the second rater and who helped with this study I talked about. And that's me.
Thank you, Alina. Really interesting study. I've got a couple of questions, but I'm wondering from the floor if anyone has any questions they'd like to ask. We've got a couple of minutes.
Can't even see anyone.
Holly just clapped. Alina, while people are perhaps typing their questions or getting out the courage to ask, I was just wondering about whether you found any differences in preference in terms of any demographics. Did you find any differences between groups or do any analysis of that?
No, not really.
Mm-hmm. Not really to having done it, or to differences between them?
What study are you referring to? The last one with leaflet?
Yeah.
We didn't have enough people to just compare, let's say, different ethnic groups. Mm-hmm. Because our sample was only 210 people, so it wasn't really enough. Yeah. In terms of gender, there were no differences.
Thank you.
Alina, why do you think people don't take their allopurinol? Why?
Would you like a short answer?
As-
Many people, as far as I understand, a lot of people, don't know what it does and why they need to take it. Because, for example, the first study I did with patients, some of them didn't know that they should take it because their GP never talked to them about it. A lot of people are concerned about side effects. A lot of people don't know about any research about long-term effects of the medication, although there is a lot about this now. Also, generally, it's hard to, some people don't want to be on medication. Like, I don't want to take any pills. I had one person who said, oh, actually, I would like to stop taking it and to see how I go, like what's going to happen. And then we had the intervention and he just changed his mind, like, oh no, I'm not doing it. So, I mean, a lot of reasons, and I can keep going about this, but.
No, but I mean, I understand it fulfills the sort of normal criteria in adherence, like there's no contingency between the symptom and the behaviour. Yeah, so that poses a challenge, fair enough. And while the colchicine, I guess a person might think there's, because you take it when you have an attack, so you might think it's related to it. But I do find it a bit surprising given, anybody who's had a gout attack, you think, you'd probably do what you could do to try and avoid the next one, because they're pretty unpleasant and they're quite debilitating.
There's another problem with allopurinol. When people start taking it, sometimes it can trigger an attack, or they might, so for example, the person might go for a year without an attack, and then they get a prescription and start taking the medication, and then they suddenly have an attack and it's very painful, or they have more attacks, more severe attacks. And again, they don't know why it's happening. So to them, it might feel like the medication is not working. It's triggering the symptoms, but actually that's just the reality. It does happen, and it is very rare to find this information anywhere, because we looked at whether materials do convey this information, and they usually don't. It's really rare.
Thank you, Nathan. All right, well, we might move on to